Hello, I'm Dr. Ricalde from the Florida Craniofacial Institute, and this is an informational video to help you prepare for your baby's cleft palate repair. First, let's discuss feeding. Remember, your baby can't eat or drink anything for 8 hours before surgery, but they can have a small amount of water or Pedialyte, no more than 4 ounces, 4 hours before surgery. After surgery, they will be offered a bottle in the recovery room. Be sure to bring any special bottles or their favorite toy so they can have familiar items with them. If you need more bottles, let us know, and we can probably get them to you before discharge. Now, after the palate repair, your baby will have to relearn how to eat with their new palate, and the palate is going to feel so different to them, so there'll be less space for their tongue and there'll be stitches poking at them. Most babies make this transition fairly easily over the first 24 hours. But some babies just don't like the way the new palate feels, and they refuse to drink. In those cases, we can try some different bottles, sippy cups, or even syringe feeds if needed. But ultimately, we need to be supportive and allow the baby time to get used to their new mouth. You will not be discharged until your baby is taking enough liquids so that we can safely remove the IV. Regarding pain, we will have your child on Tylenol and ibuprofen, alternating doses every 3 hours for the first 24 hours. They will also be offered morphine as needed for breakthrough pain. Usually babies are weaned off of narcotics within 24 hours. They will still need over-the-counter Tylenol or ibuprofen for a few days, so be sure you have some at home. Remember, this is not a very painful procedure. If your baby is fussy, be sure to check for a wet diaper, constipation, gas, and don't just give pain medicines unless they really need it. Your baby will need to wear elbow protectors for 3 weeks after surgery. They will allow movement at the shoulders and wrists, but will protect against getting their fingers into their mouth. Remember, it takes 3 weeks to heal after a cleft palate repair. Do not allow your baby to put their hands or toys in their mouth, and be careful they don't engage in prolonged screaming or crying. These actions can put tension on the stitches, and if a stitch pops, a hole can form that might require further treatment. So, to summarize, be sure you have infant Tylenol and ibuprofen at home. Keep the elbow protectors on the baby for 3 weeks, especially when they are sleeping or if you have to put them down. Following these few instructions can help minimize your risk of a complication.